Flexible and Navigable Suction Ureteral Access Sheath for Ureteral Stones, a novel Çapa surgical technique.
A 61-year-old male patient presented with left flank pain. Imaging revealed a ureteral stone and concurrent pyelonephritis. A JJ stent was placed as part of the initial management. 1 month later, the patient underwent ureteroscopy using a flexible and navigable suction ureteral access sheath. This video demonstrates the first documented ureteroscopy procedure for ureteral stones performed with the FANS sheath. Non-contrast abdominal CT revealed 4 stones in the distal ureter. The procedure was initiated by introducing 2 guide wires through the left ureteral orifice. Subsequently, ureteroscopy was performed and the stones located in the distal ureter were visualized. A 11-13 French 40 cm FANS sheath was inserted into the ureter with its tip positioned in the distal ureter. A 9.8 French red pine single-use flexible ureteroscope was advanced through the access sheath and the stone was visualized. By intermittently aspirating and releasing, the view was adjusted to visualize only the stone at the tip of the access sheath, while the ureteral mucosa was kept out of the visual field to minimize the risk of mucosal injury. External view of the procedure demonstrating stone fragmentation within the FANS sheath. The flexible scope is retracted while suction is performed, allowing for fragment evacuation. The stone is being safely dusted within the FANS access sheath using laser settings of 0.5 joules, 12 Hz and long pulse mode, while continuous aspiration simultaneously evacuates the stone dust, ensuring a clear visual field throughout the procedure. With its flexible tip, the FANS sheath allows gentle separation of the stone from the ureteral mucosa and enables secure trapping of the stone within the sheath lumen. Following stone fragmentation using a short pulse laser setting of 1.5 joules and 10 Hz, suction is performed, facilitating faster and more effective stone removal. With the vacuum effect of the fans, the stones are easily drawn into the access sheath. When the stone is inside the FANS sheath and the ureteral mucosa is not visible, there is no risk of ureteral injury. Therefore, increasing the laser parameters to higher frequencies or higher energy settings is both possible and safe. The combination of continuous aspiration and intraluminal dusting within the sheath minimizes the risk of stone retropulsion during the procedure. At the end of the procedure, a 6 French JJ stent and a bladder catheter were placed. The patient was discharged the following morning and the JJ stent was removed 1 week later. No complications were observed.